Welcome back to the Just Say Something podcast. I'm Phil Clark, CEO here at Just Say Something, and I appreciate you being here today. Don't forget to like, subscribe, share, and comment on our podcast. Episodes are available on YouTube and all major podcast platforms. Today, I want to talk about something that impacts individuals, families, young people, and our entire community: the connection between emotional health and substance abuse. When people talk about addiction, opioids, alcohol, vaping, or nicotine, the focus is usually on the substance itself. We talk about overdose numbers, warning signs, and prevention campaigns. Those conversations matter, but sometimes we miss the bigger picture. Because many times substance abuse does not begin with someone wanting to ruin their life. It begins when somebody trying to cope with life. Trying to cope with stress, anxiety, trauma, loneliness, grief, depression, pressure, or emotional exhaustion. A lot of people are not chasing destruction, they are chasing relief. According to the National Institute on Drug Abuse, there's a strong connection between mental health conditions and substance use disorders. Many people experiencing anxiety, depression, or emotional distress may turn to substances as a form of coping or self-medication. That matters because if we only focus on substance and never talk about the emotional struggles underneath, then we are missing a huge part of the issue. We live in a time where many people are emotionally overwhelmed, but they feel pressure to hide it. People are expected to keep functioning no matter what they are carrying internally. Someone can look completely fine on the outside while privately struggling with stress, burnout, or emotional pain. And when people do not know how to process emotions in healthy ways, they often look for escape. Sometimes it starts small. Someone vapes because they think it helps with stress. Someone drinks more because they often feel overwhelmed. Someone takes pain medication and realizes it numbs them more than the physical pain. What starts as temporary relief can quietly and quickly become dependency. The CDC has also emphasized the connection between stress, trauma, mental health struggles, and increased risk for substance misuse. Emotional wellness and prevention are deeply connected. I think this conversation is especially important during Men's Health Month because many men struggle emotionally in silence. A lot of men grew up hearing things like, man up, handle it yourself, don't talk about feelings. Over time, many people become very good at suppressing emotions without ever learning how to process them in healthy ways. But emotional suppression does not make emotions disappear. Usually it makes them louder over time. And people need to hear this clearly. Struggling emotionally does not make you weak. Talking to someone does not make you weak. Emotional health is health. According to NAMI, many people living with mental health conditions also experience substance use disorder at the same time, which is why honest conversations and support matter so much. This conversation also applies to young people in a major way right now. Teenagers today are dealing with social media pressure, anxiety, academic stress, loneliness, and constant comparison online. Unfortunately, many people turn to vaping, nicotine, alcohol, marijuana, or other substances because they believe those things help them cope emotionally. But substances may numb feelings temporarily while creating bigger long term problems underneath. SAMHSA continues to stress that early emotional support, prevention education, and healthy coping skills are critical in reducing substance misuse and improving long term outcome for young people and families. That means prevention can not only sound like punishment or lectures. Young people need trusted adults. They need emotional support and honest conversations. Sometimes they simply need someone willing to notice that they are struggling before things spiral further. Families also need to understand that emotional warning signs are not always obvious. Withdrawal, irritability, isolation, emotional numbness, mood swings, and sudden behavior changes can all be signs that someone is struggling emotionally. And while accountability matters, compassion matters too. Sometimes, instead of only asking, "What is wrong with this person?" we should ask, "What is this person trying to cope with?" That question changes conversation. One of the most important things we can do as communities is help people build healthier coping skills before substances become the answer. Stress and emotional struggles are a part of life. The goal is not pretending that these emotions do not exist. The goal is learning how to deal with them in healthier ways. That may mean counseling, support groups, exercise, faith, mentorships, healthy routines, or simply having safe people around you. At Just Say Something, prevention is not only about saying don't do drugs, prevention is also about connection, helping people feel heard, supported, and valued before they go looking for relief in harmful places. Because sometimes the difference between somebody spiraling deeper and someone getting help is one conversation, one trusted adult, one friend checking in, one person willing to listen. Connections matter more than we realize. If you're listening today and you've been struggling emotionally, please know you do not have to carry it all alone. And if someone in your life is struggling, do not underestimate how powerful your support and presence can be. Sometimes prevention starts long before substances ever enter the picture. Sometimes it starts with emotional support, healthy conversations, and connection. Thanks again for listening, and we'll see you next time on the Just Say Something podcast. Until then, be safe.